I have been crying for days. We know COVID is basically a killer for the elderly.
The day after my mother died, we got their invoice for the August fees. That's the only contact I've had.
This nursing home in Melbourne's northern suburbs is now in the grip of the deadliest COVID cluster in Victoria's second wave. 81-year-old Chrysanthi Angelopoulos had only been living at St Basil's for a few months.
She was one of the first few that tested positive.
My mother was at the end of the building. No one could hear her, screaming her lungs out for someone to come and help her.
My wife was very fortunate to have rung and gotten through to the COVID specialist. War zone.
He said it's a war zone. It's mayhem in here. Because there was a lot of patients with COVID and a lot of people had fear. When they said she needs oxygen, she's severely dehydrated, that got my alarm bells going.
Chrysanthi was evacuated to Bellbird Private Hospital on Saturday.
She's gone from symptomatic, showing symptoms, to not needing oxygen and being able to breathe on her own. And that's the actual place she's in still now. She's actually okay. She hasn't got oxygen, but she's not in St Basil's, thank God.
St Basil's was once home to 120 residents, with more than 100 staff on its books. Only a few dozen residents remain. The rest have been evacuated and 9 have died.
I still am very angry because I believe that my mother's death could have been avoided.
81-year-old Maria Vasilakis tested positive to COVID-19 and died at St Basil's last week.
Today is the day of the viewing for my mother, and it's going to be very brief. And you're not allowed to touch or anything like that. It really just hurts because that's not our custom, that's not our way.
He's still furious about what he saw at St Basil's in the days leading up to his mother's death.
So my sister and I put on all the PPE gear, and I mean, we found our mum, there she was in her bed on an oxygen tank, but slumped over to one side, and it took 2 or 3 calls for someone to come and position her right.
Another resident tried to enter his mother's room.
She was walking into what we knew 100% was a contaminated room, but no one did anything. No one did anything about this lady. They're the things that that were showing that staff were overwhelmed, not trained well. It was a mess.
The first positive case was detected on the 9th of July. 4 days later, protective equipment was made compulsory for all staff. On July the 15th, nearly a week later, all residents were tested. Last week, the federal government staged an extraordinary intervention, replacing all St Basil's staff with a new team.
How did we get to this? How did we get to a state where all its private aged care homes are riddled with COVID-19? So I have to think that it's not just St Basil's. My experience is St Basil's. I've got a feeling that other people who's got their loved ones in other aged care homes have had the same experience, have witnessed the same as I have.
There are 804 cases of coronavirus linked to aged care residents and staff. The biggest clusters are at Estia Health in Ardea, Epping Gardens in Melbourne's west, and St Basil's. And there are another 7 aged care deaths over the past 24 hours.
Right now, the aged care sector is in crisis. The ultimate responsibility lies with Minister Hunt, the Health Minister, and Minister Colbeck, the Minister for Aged Care. They are ultimately responsible for what is going on in the aged care sector.
Richard Colbeck declined our request for an interview.
So I think aged care around the country has been immensely prepared. We have had, prior to the Victorian outbreak, less than 0.5% of facilities affected.
It's a little bit like the sinking Titanic, isn't it? The response from the federal government has been far too slow and far too late.
I never thought he would die of COVID, never in my wildest dreams.
Fred Hickey died just before midnight on the 15th of July. He caught the virus at Menna Life Aged Care in Essendon.
When I left him, my husband was perfect. He was eating chocolate, he was having coffee.
And so I didn't see Dad for, well, not long after COVID started. And that was very hard. And yeah, I wish I could have spent more time with him, honestly. And that really hurts.
Days after being taken to hospital, Chrysanthi Angelopoulos remains in a stable condition. Her family says its time-aged care homes put better infection controls in place.
But right now, what they've learned in Sydney in March, what they've learned today in all the nursing homes in Victoria that have been hit, and they're pretty much the highest rate of deaths, the highest rate of infections in Victoria, right? Start preventing it in nursing homes by, don't worry about the ones that they've got it, you've got now the government in there. What about the ones that haven't got it? Get ready for them.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.